There are lots of questions about the coronavirus vaccine, and that's especially the case now that thousands of healthcare workers in our area have gotten it and millions more people are on the list of those who can. New at 5, I talked with UPMC's Medical Director of Infection Prevention to answer some of the most common questions. So, Dr. Snyder, many people know friends or family in healthcare who've gotten both doses of the vaccine. Can we now be around those people without wearing a mask or social distancing?
It's still important to mask and distance. Masking and distancing is the way that we prevent the virus from being transmitted. We're very excited that the vaccine is much more effective than we would have guessed. But that measure of effectiveness is a measure of how well the vaccine will prevent you from getting sick. We don't know yet how well the vaccine will prevent you from being contagious if you're exposed. So that's one of the reasons why it's still important to wear a mask and distance to protect those around you, even if you've had the vaccine.
So I understand some people have a reaction, particularly to the second dose of the vaccine. Would you advise people pre-medicate to avoid some of those symptoms, maybe taking Tylenol or Advil?
I generally recommend somebody take medications before getting the vaccine, but you may need medications afterwards if you're having some symptoms. Lots of people who get the first and the second dose have no symptoms. Lots of people just maybe have a sore shoulder or some other symptoms that the immune system is being activated. These are symptoms like you may feel a little feverish, you may feel achy, you may feel a little run down. These typically only last 1 or 2 or 3 days. And for most people, you don't need any medications to be able to get through that.
So Pennsylvania opened up its vaccines to millions more people, including those 65 and older, and people 16 and older with certain health conditions. How and where can these people sign up to start getting the vaccine?
Everybody is ready to give as much vaccine to as many people as possible. And the more organizations that are able to give vaccine, the better off that we are. The state is distributing vaccine to healthcare organizations now, and we're, of course, eagerly anticipating the state distributing vaccine to more organizations like pharmacy. So you may have a lot of opportunities to get the vaccine. I encourage you to seek out those opportunities on the Pennsylvania state website.
And Dr. Graham adds that it will take time for people to find places to get the vaccine on the website because there still is not enough supply. He also says UPMC is still giving it to all their healthcare workers before they can open it up to the rest of the 1A group. And you can see my full interview on CBSN Pittsburgh tonight at 7 o'clock.